Now we're scanning the abdomen by using convex probe, placing at epigastrium in transverse position. Here we see the left lobe of liver, and this is duodenum, which contain air and food particles. Now tilting the probe downside. Here we see the pancreas, which shows heterogeneous texture and echogenic and less echogenic texture, but appears to be normal in size. This is porous planning confluence. Here we see the fluid containing debris at peripancreatic area and posterior to the head and neck of the pancreas. Here we see the left lobe of liver. This collection is present between the pancreas and liver. If we focus on the head and neck of pancreas, it also shows heterogeneous texture and margins are also irregular. This is gallbladder fossa. The gallbladder is absent due to cholecystectomy. This is left lobe of liver. Here we see collection in the gallbladder fossa. If we focus here, we see that the collection is continuous through a tract or sinus to the subcutaneous muscles. This is laparoscopic tract at epigastrium area. The laparoscopic scar at epigastrium is healed, but the collection is present in the subcutaneous tissue up to muscle layer. Now we will measure the volume of collection. Approximately 108 milliliter collection is present at gallbladder fossa. Here we see that the liver shows coarse texture or decreased echogenicity. Now we will examine the common bile duct post cholecystectomy, whether it is normal or dilated. This is portal vein, which is normal, and this is common bile duct, which is normal and not dilated. Now how we will write report.